Okay, we have 24 participants so far, so we'll get started. Oh, just 1 second. We're just gonna take off Wendy's video there. Stop video. Okay, there we go. Okay, so thank you to everyone who has joined us today. My name is Julia Alton, the Executive Director of the CFA. Co-hosting with me, I have Christine White from the Gaucher Foundation, Kim Angel from MPS Society, and Brad Crittenden from the Pompeii Association. The world is going through something challenging right now. It's unknown, and as human beings, I don't think we find a lot of comfort in the unknown. We want answers. We want to know what day the social distancing will end. But of course, we really don't know because it depends on the 7.8 billion people in the world with us. So in this extraordinary time, thought it would be great to shed light on what we do know. So we've launched a virtual education series featuring COVID-19, and we will continue to do this for as long as our communities need us to. Our next chapter is a psychotherapist, our next speaker is going to be a psychotherapist, and she will be on April 8th at 7 p.m. Eastern Time. So stay tuned for those details. In the midst of the pandemic, there has been many patient concerns, but a major one brought to our attention is the measures in place for all those receiving home infusions. Myself and the other executive directors have been in discussions with the home care teams, and we want to ensure you that they have implemented a higher level of protective equipment to ensure everyone's safety at this time. I know it can be a little scary having nurses coming into the home, and so we want to make sure that we're hearing any of those concerns, so feel free to contact us if you have any questions about that. We do also reach out to the other executive directors, and we do have information posted on our website as well. So for everyone listening in, you're in for a treat. Dr. Seema Kanwal is a fabulous presenter, and she will be talking with us today about how to keep our immune system strong. Dr. Kanwal is a naturopath in Vancouver and also very proud to have her as a CFA board member. So throughout the presentation, if you have any questions, just save them for the end. There's a chat box at the bottom of your screen, so you'll be able to chat and just write them in after, and there'll be some room for discussion and questions. So without further ado, Dr. Kanwal, I will hand it over to you.
Thank you, Julia, and to thank you everybody who's joining in. Our goal for really today's talk is people that are very scared. I want you not to be. Really, at the end of our discussion today, I'm hoping that everybody will leave with a sense of empowerment and the sense of, what we know. Let's look at that, and what we don't know, we don't have control over. So I'm going to go through what the actual virus is and, the past experiences that we have had with other similar things. And then at the end, we'll talk about, what we can do to stay healthy. Now, there is absolutely no cure for this. We all know this. There is no drug currently. There is no integrative natural therapies that is shown. There's no data because this virus is so new. So to start with, I'm going to explain what exactly this is. So this is just a little bit of the nomenclature. So SARS-CoV-2 is the actual virus itself, but the disease that it's causing is named COVID-19. Now, we have most likely heard of the other coronaviruses, which is the MERS-CoV, the SARS-CoV, and now is the SARS-CoV-2. So this last one is what we're currently in right now. So this virus is not SARS-CoV-1, and it's not MERS, and it's not influenza. So there's been a lot of, readings I've been doing and online, people sharing wrong information on social media that we're comparing this to influenza. You cannot. It's like, comparing an apple to a broccoli. You can't do that. It is a very unique virus with unique characteristics, but it does have similarities to the SARS-CoV-1. So far, the world has seen three pandemic types caused by the coronavirus. So the first one I personally remember very distinctly because it was the severe acute respiratory syndrome of coronavirus, SARS-CoV-1, that was actually identified in 2003, following a 2002 outbreak, which did also originate in Asia. I was actually in the hospital in Toronto, North York General Hospital, where SARS was very rampant, giving birth to my first child. So this is something that's always in the back of my head, such as 9/11, that things that you don't forget. And now this is from the World Health Organization. This is a world diffusion of that SARS-CoV-1 pandemic that we had back in 2003. You see the transmission was from Asia to growth in Canada, but didn't spread like wildfire like this one we're in. Now, the Middle Eastern Respiratory Syndrome, MERS, that appeared in 2012, and that actually originated from Saudi Arabia. Now, throughout this presentation, I have lots of data. So if anybody's interested in looking at any of these papers, I'm happy to share them, and Julie and I will arrange for all of that. So I want to share a little bit about just, what's happening right now. So I started working on this presentation on Monday, and the COVID-19 is changing every single day, sometimes every hour, right? It really depends on where you are. Now, this stats I got from the World Health Organization. On March 23rd, which was only a few days ago, we had only 332,935 confirmed cases. Now, that means that the people that have been tested, we actually don't even know the untested individuals. 14,000 roughly around deaths, and then 189 countries, areas, or territories. Now, last night I was on the computer, and the numbers were as following: 416,000 on the right there, 686 confirmed cases, 18,000 deaths, and 196. Before I got on the call today, I looked up the statistics at 12:30 today, and just from last night today, it's already jumped to 462,000. And the number of deaths are 20,000, and the number of territories and countries affected now are 199. So you can see, I can understand why people's fear is there, because this is such an ever-changing thing that we're dealing with. So the SARS-CoV-2, or the COVID-19, is not the most lethal or transmissible, but it is lethal and transmissible. So there's this dichotomy there. So the COVID-19 is particularly lethal for a certain population group. Now, there was this old information that children and adolescents didn't seem to get sick, but are viral carriers, and they have an increased transmission rate. But now the data, now this was a week ago, but now fast forward to this week, we now have data out from Italy that this is actually not the case. The people in the hospital in New York and in Italy currently are actually, the youngest, I believe, was 19. Now, if somebody has newer information, please correct me if I'm wrong. That's just what I was able to find, that the youngest person currently is 19, and they are in the ICU. So this does not actually distinguish. So do children or adolescents, are they at risk? Yes, in short, I think everybody is, to be honest. So, but this is the group that's the most vulnerable, is this population. Now, the data is saying that if you're over the age of 70, if you have something of an underlying health condition, whether that be a metabolic disease, any type of heart disease, and if you've had an organ transplant, so immunosuppressive therapy. But really the challenge here, what we saw at Wuhan, China, the reports that have come out of that, it's the healthcare workers, the first responders that had been infected, and 15% of those in China are the ones that became seriously ill, because they're the one dealing with all of this so quickly. So currently, the challenge right now is developing some type of vaccine and antiviral drug intervention is all being looked at. And the vaccines, we all know, are the highest bar in terms of testing. But that whole process is very lengthy. It's very difficult with these timelines, because in order to develop and trial a process for a vaccine, it takes anywhere from 2 to 3 years. There's 3 different phases that a vaccine has to go through. Is a safety phase, which is phase 1. Phase 2 is the expand to demonstrate safety and some type of efficacy. And then the last phase is the safety and efficacy in the actual disease condition. So SARS-CoV-1 and SARS-CoV-2 actually share about 80% of the genetic code. So there is hope that the development for a vaccine for SARS-CoV-2 can be actually taken from the first SARS-CoV-1. But again, we don't know that yet. Now, I've had a lot of patients very, very concerned about, the reported pathology that's out there, that, SARS-CoV that we're dealing with right now, that virus uses the angiotensin converting enzyme 2, an ACE2 receptor that binds to the SARS-CoV. This protein has a very high affinity for it. So when we look at this carefully, the actual ACE2, the SARS-CoV virus, uses the angiotensin 2 converting enzyme as a functional receptor. And that ACE2 receptor entry can explain the diverse symptoms that normally infected individuals have. So if you look at where this protein is, it's on the kidneys, the blood vessels, the heart, and more importantly, it's on the lungs. And the receptors that are most abundant is actually the lung. So this is very, that's daunting for people with lung issues, such as, the Pompe community, as well as now there are receptors also in the ileum and the colon, which is why there are a few people that have been experiencing GI manifestations as well for this. And then the question I've been asked by patients is, well, I'm on this ACE inhibitor, should I stop? And the answer is absolutely not. You are given a medication to help control blood pressure. If you all of a sudden stop your blood pressure medication, what's going to happen is you're going to be even more at risk of going through a hypertensive crisis. And the last place you want to be right now is in a hospital. So the best thing for you to do is really maintain your isolation, your social distance. Don't go out if you don't need to, for people that are on some type of heart medication. So hopefully that answered that one for some people. Now the route of transmission is still not fully clear. There are some identifiable modes, such as, the airborne, if you're directly in contact with somebody. Now, an aerosol, it can live for approximately 3 hours. Those are some of the reports right now. This could obviously change, 4 hours on copper, 24-hour on cardboard. So then, I've been asked by many patients over the last week and a half, like, what if I get a package from Amazon? What do I do with it? So there's a lot of, been fear around that. But again, it's, we have to look at these things on a realistic scale as well. Now, the other interesting piece is that this virus can actually live for about 2 to 3 days on plastic and stainless steel. So some of the papers that I was reading was that 13-hour half-life on steel and then 16 on something like plastic, which can be a little bit disconcerting. So the virus is transmissible because it can live on all these surfaces for anywhere from 8 hours to 72 hours. The mode of transmission is very significant because viruses can survive and transfer in a few different ways. So that means that there's a high reproductive number. So when we look at, people being infected and, what does this mean? It's essentially, you want to look at, compared to a seasonal flu, which is 1.2 to, 1.3 people will get infected with something like this. It's 2.24 to 3.58, which, just people that like data, for measles, it's like 12 to 18. So it's really a question of, is this something to be worried about? Yes, you do need to take every precaution possible, especially if you have something like a lung issue or a heart issue, what have you. The immune system is absolutely critical. It's very, very important. The concern, though, is often that the SARS-CoV-2 right now uses this angiotensin converting enzyme as an entry. So viruses are not truly living like bacteria. They have genetic material, like the coronavirus carries RNA, so not DNA. The RNA contains the instructions set to make the protein, but not the machinery to replicate. So that's how the virus is to me, is like a true parasite. So the virus infects a host that has all the machinery to help it replicate. So that's what we are. We would be, the host that contains everything that it needs to thrive in our body. So what the hell did I just say? What does this mean? So the system that gets attacked are the receptors that the SARS-CoV-2 uses to infect the lung is likely this. But again, this could change in a week from now. I don't know. This is what the proposed theory is currently. So the cell surface protein on cells in the kidney, the blood vessels, the heart, important, the lung alveolar epithelial cells are the most critical. So the virus infects cells in the lungs, and those cells are called pneumocytes. And in the process, it replicated actually damages the cell. So that's how patients have come out or ended up with having acute respiratory distress syndrome. And that occurs from damage so that the lung will actually fill with air and collapse. So people that contract COVID-19 need to often be on some type of respirator and sometimes need mechanical ventilation for up to 5 weeks. And that alone, that cells in the lung make something called surfactant, which is really critical. But what's scary is the data that we've been reading now from Italy right now is that it's actually affecting people in their 30s or 40s and 50s that wouldn't normally be immune compromised. So something to really pay attention to. And cardiovascular disease is another one that seems to be a better predictor of complication, more so than the lung or respiratory pre-existing condition. So hypertension and cardiovascular disease is higher than lung disease, and how poorly someone may respond to this. And remember that ACE2, angiotensin converting enzyme 2, is what helps recycle and turn off angiotensin 2, which is what your body makes after there's a cascade to increase blood pressure. So people with the hypertension, the amount of angiotensin 2 is higher. So there are reports that some are now having myocarditis, which is inflammation of that cardiovascular muscles. And these is, reports that I've been reading that's, right out of Italy. So these are some of the potential drug therapies that are being used, right? Like that was being used in China and in Italy. None of this is actual treatment yet, though. There's Plaquenil, which is also known as hydrochloroquine. That's a medication often used for autoimmune disease, and it's been widely used as a generic medication. And it doesn't have a lot of side effects. Remdesivir was actually an antiviral drug that was developed for Ebola, but it's only given IV. And there's some studies right now that are underway that medication promises some type of faster approval than possibly vaccines. There's another interesting one right now from Italy where convalescent plasma therapy is being tried out. What that means is that they take blood from a recovered person, extract the antibodies from their blood, and give it to somebody who's actually sick. That's super cool to me. I think that's pretty interesting. And then there's a couple of others there too that I've listed. Again, if anybody's interested in this, I can happily pass it along. Now, the last one, potential drug therapy, is what's known as ARBs there, the angiotensin receptor blockers. Now, originally it was thought that angiotensin 2 receptor blocker could be an effective treatment. Now, if it's able to block the virus, then you could prevent the disease. But a couple days later, what they saw within the 2 weeks was that being on ARBs was super common and the safety profile was high. But since the ACE receptor is unregulated, now we know that maybe you're more susceptible to the virus. But again, like I said earlier, if you're taking the medications, you absolutely need to stay on them, because the issue of the hypertension is why you were originally prescribed it to begin with. The chloroquine that I mentioned in the last slide there is being used off-label, and showed the reports that I was just reading last night was that the chloroquine showed a rapid decrease in the viral loads of like SARS, MERS, and Corona. So it makes it easier for the immune system to destroy the virus. And the doctors in Wuhan actually tried this on several people, and it seemed to have worked. And few of the HIV medications have also being tried right now in conjunction with chloroquine. They have not seen any obvious harm by using in severe cases in China and Italy, and actually in London was a third place. That might be a standard protocol for people, but again, there's nothing there yet. This is just all happening so quickly right now. Now, after all that, we have to remember we're going to get through this. I have faith that as long as we all pull together, we're going to make through all of this. And remember, the stronger that we are in our mental, emotional, and physical self-care, the more healthier that we will actually stay. And the healthier that we stay, the stronger we will be, not only for our families, our friends, our coworkers, as well as our community there. This whole social distancing that so many of us are practicing right now, it doesn't have to feel unbearable or stressful or isolating, but I cannot stress the importance of it's absolutely necessary. The more we can stay home and stay put, the faster we'll be able to get through this virus, this crisis itself. And there are lots of different things that we can help everybody here with. This is among probably the most effective preventative measure is the social distancing. I think of it this way that, the kids and I have three of them at home, and there's conversations, especially with the older ones that we've been having. It's like, it's not about, somebody else being sick and then you contracting it. Think of it that I'm the sick one. What would I do to protect me and my family and not infect somebody else? So, I mean, I'm in Vancouver, and all restaurants and, all these things are all shut down anyway. All travel has been canceled, but working from home is not necessarily easy. As you can see here, I'm actually in my office, and the reason being, there's nobody here. The doors are locked. I have, three people at home that are always yelling for me. And so the only place I thought I had was the bathroom, and I didn't think you guys wanted to see my shower in the back. So I came here alone. That's why I'm here. Practicing good hygiene. I would hope that we were already doing this, but this is, if nothing else, this is a great friendly reminder. There's lots of different, celebrities online singing and doing all these things that, that can help you wash your hands for those 20 to 30 seconds. And hand sanitizer is okay, but it's not completely necessary. If you're out and about, you do your best to wash your hands absolutely frequently, and please don't touch your face. I know that's really hard to do. If you can, if you're needing to go to grocery stores or whatever, as we all sometimes have to, grab a pair of gloves, put those on, and then this way you're not accidentally touching anything, and wipe down those buggies. Staying home cannot be stressed enough, but there's lots and lots of things that we can do when we are home. I don't know about any of you, but I've actually taken a couple of drawers and cleaned them out lately. Like, this is interesting because I've been wanting to get to them and not been able to. But, playing games with your kids or, something, and preparing, actually cooking at home. I think that if all of us actually stayed home anywhere for about a couple of weeks, at least 3 weeks, we could significantly slow this this pandemic around us. Protecting those at risk is probably the most critical thing. The CDC recommends that people over 60 stay home and avoid unnecessary contact. So if you have elderly parents, any way you can, try to support them, like dropping off food or supplies so that they themselves don't have to actually go out. My mother-in-law, unfortunately, is going through cancer treatments, and right now we're all in the limbo, like, does she continue, does she not? So all this is, can really plague a lot of families out there right now. So it's understandable how scary this can be. Now, one of the easiest thing that if anyone's have heard me talk before, will know this is my normal thing, is constantly telling everybody, to support your immune system, you want to eat whole foods and nutrient dense foods. There is a ton of data out there that shows us that our immune system relies on nutrient dense foods. And a lot of times when we see in the developing world death from infections, it actually oftentimes is not the infection itself. It was the inability for that person to be able to fight because of the depletion that they had of the nutrients in the body. So flavonoids are actually found in berries and onions and in other produce, and they will reduce the incidence of upper respiratory tract infections. So again, I've got data on all of this. If anybody wants it, just ask and I'll send it along to you. Vitamin C is found in the foods like broccoli and kiwi, and the antiviral properties of them are absolutely phenomenal, and anti-infectious effects. So broccoli is something that's interesting because broccoli itself contains the green pigment there. The easiest way to cook broccoli is if you are steaming it. The second it changes color, you shut it off, because now what you've done is activated sulforaphane. And sulforaphane is phenomenal at supporting your own body's immune system. Something like cauliflower is hard to do because it's white, so we don't know the difference in color. But what I do my own self is I'll throw a stalk of broccoli in there. So as soon as the broccoli is done, I know the cauliflower is done. It's a little trick if you want to use it. Cutting out refined sugar and starches. This is our nemesis. There's this thing going on Facebook right now. I don't know if other people have seen it. It's called the COVID-15, where supposedly people are going to be gaining 15 pounds during this COVID stay-at-home thing. Please don't do that. It's unnecessary. Now is the time to eliminate that sugar and the junk food. And there are study after study that show that refined sugars can actually suppress your immune system for hours after ingestion. So limiting starch and sugar will really help improve your immune system overall. But this also includes alcohol, unfortunately. So one of the things that I have found over the years really worked for me personally is actually lime. Lime really helps curb that sugar craving, that tartness. I find lime works almost a little bit better than lemons, even surprisingly. Here's my alcohol. So sugar also includes alcohol, unfortunately. Excess alcohol consumption, we know, will affect innate and adaptive immunity, and this leads to a significant weakening of our normal ability to be able to fight infections. So it's not just sugar as a whole, but it's also the drinks, the soda pops, and what have you. All of that, the high sugar intake is associated with an increased mortality risk from all causes. And there's, again, data out there that if anybody cares to see, I'm happy to share. Now, an easy thing you can also do is adding things into what you normally cook. So garlic, onions, ginger, all these spices, oregano, turmeric, especially turmeric is a great anti-inflammatory. All of these you can add into your soups and your vegetables. And one of the things that that in Chinese medicine and in all different types of medicines is actually mushrooms. Now, some people absolutely hate the taste of mushrooms, but if you can handle the taste of mushrooms like shiitake mushrooms or anything, adding that into your cooking is also major at increasing your own immune system, but also supporting against many different types of cancers. The research out of Germany are huge when it comes to intake of mushrooms. And of course, the more colorful fruits and vegetables you can have, the better it will be for you. So in my house, what I've been doing lately is everybody picks a color, and based on the color is what food we're going to have. So try to aim at least 8 servings of vegetables and any 2 of fruit. So a serving is about half a cup. So this, we think that this is a lot, but really when you think about it, a quarter of a pepper is considered a serving. And like only 5 small pieces of broccoli is considered a serving. Those are very, very easy to get into ourselves. On March 20th, the Director General from the World Health Organization, Tedros, I can't even pronounce the name, so I'm not even going to try. He shared a bunch of tips on looking after yourself physically and mentally during the COVID-19 pandemic. And funnily enough, one of the first things he said was also to have nutritious vegetables and fruit. But the biggest thing was the smoking. The smoking has been what they're seeing, and what the biggest difference between China and Italy was actually the amount of people that smoke in Italy and in New York. So smoking, what they are finding at the WHO is that smoking can actually increase your risk of developing severe disease if you become infected with it. And remember, we just explained that this virus likes to attack and sit in the lungs. So if you're a smoker, your risk is potentially, according to the WHO, actually higher. Now, exercise, we all know is critical, but if you're a smoker and you're trying to quit, there's lots of resources out there that will help you at this time, especially. Exercising at a moderate intensity for about 5 minutes can actually reduce your craving to have that cigarette, along with helping support the withdrawal symptoms. Now, continued physical activity can actually help you quit in the longer term, and I've seen also improve moods. So WHO recommends 30 minutes minimum for adults of activity, an hour a day for children. Now, it depends on where you are right now, whether you're allowed to be out or not. I have, some patients out in Tel Aviv today that I spoke to, and they're on complete lockdown. My parents are actually in India right now, stuck, and they're not able to come back to Canada. They're in full out lockdown. So obviously in your place that you're in full lockdown, you're not going to be able to go outside. But if you're wherever you are that allows you to at least go outside in your neighborhood, it's amazing that if you can at least get out for a small walk or a run or a ride, like ride a bike or anything like that. And obviously keeping your distance from other people, try to do something. Now, if you're somewhere that cannot leave, YouTube has so many free videos right now, and a lot of people out there are offering free yoga, free dancing, or there's so many things online right now that you can look at that are all free. Now, the way exercise works is it'll boost your immune system by causing that white blood cells to actually rise. So you'll be able to detect illnesses quicker. So that rise in body temperature, that breaking of the sweat, it will help you ward off your infections. But also think of it this way: your skin is your largest organ of elimination, and that's something we don't use. We think about, we have our kidney, our liver, our bowels, all of that, but we also have our skin. The more we sweat, the easier it'll be for us to maintain our immunity. Now, it is, I get asked a lot about what supplements can I take, and what is actually going to help me. I need to reiterate that there is no clinically evidence-based integrative prevention right now to treat COVID-19 virus infections. But these are the things that are commonly used to help support your just to support your immune system in general. For the fibroid community, we've talked often about vitamin D supplementation. If you look at just our body as a whole, all of our cells in our body, every single cell in our body contains two receptors, D and thyroid. So knowing just that alone, vitamin D is actually critical for our stability of our mood, for our brain health, but most importantly, our immune system. So depending on where you are in your life, whether you're premenopausal, postmenopausal, childbearing years, what have you, would determine the amount of D. But generally, the WHO and the FDA and Canada guidelines are around anywhere from 1,000 to 2,000 units. But again, that's changeable depending on you. And there's an easy blood test to do too for the vitamin D to check what your levels are. Vitamin C is known throughout. In China, they've been using actually intravenous vitamin C. I was just reading a paper earlier that they've been using that for people severe, which is very interesting. But vitamin C as a general is a great immune system support. And zinc is something that's actually required throughout our physiological processes in our mitochondria. But zinc is something that you don't want to be taking all the time either. Zinc can cause a copper issue. So something with zinc is, if you're a healthy individual, I often say with zinc, you rotate it. You take 1 month off, 1 month off, and just rotate it all the time. Elderberry, they're finding as well. Elderberry I use often to support one of my kids in general. She constantly gets upper respiratory tract infection. She's 12, almost 12. And elderberry is something I've always had in my cupboard for the last 10 years because it really has helped in the upper respiratory tract infections to help it, get her through this a lot quicker. Now, vitamin A is interesting. Vitamin A is an amazing anti-infection, antiviral. However, depending on where you are in your childbearing years, what have you, vitamin A is contraindicated. Now, vitamin A also is really helpful for an active infection, not COVID. I'm talking about just generally if you're feeling under the weather, if you're not feeling well. Vitamin A is very helpful when it comes to, supporting you through, but also for preventative. So, something you can do easily is taking, 10,000, it comes in high dosages. So 10,000, 25,000, depending what you can find at your pharmacy. Taking that once in a while, definitely not every day, especially in your childbearing years, you're not to take it at all. But general population can take, anywhere from 10,000 units once a week to once a month, depending on you. Super, super helpful. There's a great study I was just reading about of how exercise and sport really helps to improve our ability to be able to handle respiratory viral infections. So again, exercise cannot be reiterated enough. The inflammation that exercise will help for you to help tame that inflammation is absolutely huge. Mentally, now, we really have to look after our mental health, not only for ourselves, but for each other. Feeling stressed, feeling anxiety around this time, given all the news that's out there, completely normal. However, we have to remember that when you're feeling this type of anxiety, this is actually possibly going to lower your immune system and means your risk of infection. Now, I still can't pronounce this guy's name, unfortunately. The director at WHO said it's normal to feel stressed, confused, and scared during a crisis, but talking to people you know and trust can absolutely help. And supporting other people in your community can help you as much as it'll help them. Checking in on neighbors and families and friends, doing WhatsApp. We've been doing WhatsApp with my family and, using phone videos and what have you. Those are all, things that we can do with each other. My son actually just taught me the other day that apparently in Netflix, you can watch movies with other people. There's a streaming thing that everybody can do together. If you all know about it, that's great. I only just learned about it this week, but very interesting how, you can really keep in touch with other people. You don't have to be fully isolated. So this is my little list, I think, of the most important things. Making sure that you are hydrated. That's number 2. I actually should have done that as number 1, but the first thing is make sure you have a good filter. So then this way you don't have to use up bottles of water, but having a proper filter at home and making sure that you're being hydrated, throughout the stress stuff will really help support you. The second thing that's actually is one is, food, making sure that we have as many fresh vegetables and fruit as possible. And sometimes, some grocery stores I've been at in a couple of weeks now, they're out of stuff, and that's okay. So if that's the case, then make sure we get stuff that's frozen, or we buy when it is available and then freeze it. Now, mood is a very, very critical one. I want to talk a little bit about fear here, because I've received a lot of concerned people in the last little while. Now, you want to feel fear when it's appropriate and useful, right? 99% of the time when we feel anxiety or negative emotion, it's often wasted. So negative emotion is not driving us for any good purpose. It's great to feel anxious when you're encouraged to do something useful, like I was right before our talk today. Feeling that little bit of angst is for sure normal. But when we feel anxiety is often when we don't know what to do. Like, do I get groceries? And if I do, where do I go? Where is it safe for me? Our mind is amazing at ensuring that our perceived reality is much worse than it actually is. So it's okay to feel the fear, but let's channel it. Uncertainty at this time is huge, and there's nothing we can do about it, because we don't know April 1st what's going to happen. We have no idea, and being here and present right now, I'm hoping, is what's going to help people through. Having the conversations, number 4 there. Reducing social media is critical. There is so much garbage out there. There's so much misinformation and scaremongering. That's not going to help anybody at all. Hobbies. Now is the time to, if you have a hobby and you haven't picked it up, great time to restart it. And what I would challenge everybody, honestly, is your mind. I challenge you to either finish a book that you had started that is probably sitting collecting dust, like I originally had earlier this week, or let's start actually a new book. Is there a book that you've been wanting to read for all this time but never had the time? Well, this is your time now. Let's get things started here. There's a whole host of books that I absolutely love to read. If anybody wants some suggestions, I can give them to you, depending on what you're into. And of course, movement. These are probably my top 7 most important go-tos. And now I was also asked many times, like, what is proper, resources that I can go to? These are probably the most credible sources out there. If there's others, please send them over for me. But World Health Organization, Centers for Disease Control, and Health Canada is where you're going to find the proper information. And that's that, Julia. I want everyone to, also remember that when you're stuck in your home, it's like, what is around us, right? What do we see? If you hopefully have some type of a view of something, plants or trees, or, hopefully you have a view. And if you don't have a view, getting some nice pictures, looking at some mountain pictures or whatever you're into, keeping ourselves in that focus and that clear.
Thank you, Seema. Every time you present, I learn something new. So thank you so much. And it's great that you put the credible sources, included those as well, because I think that's really important, and to lessen, social media, and even if you need to turn off the news every once in a while, because it can be a lot to take in if you just have it going on in the house all day. So at this time, we like to actually, go ahead.
I've been telling people lots that you need to limit yourself to 1 news a day. Yes, we need to be informed, but either pick your time. You want the 6 o'clock news, you want the noon news, you want the 6 p.m. news. Take your pick, but don't do all 3 of them. That's not helpful for anybody.
Yeah, exactly. So if we're going to do 2 things. One is we have some room for questions. I think the discussion is really important. So if you we're going to look for 2 things right now. At the bottom of your screen, you may have to pull, put the cursor over it. So the bottom of the screen, you're going to see a chat, and you're also going to, so chat's towards the right, and then on the left, the far left, you're going to see something that says video, and there's a little video. We think it'd be really cool to just have everybody pop on really quick for a second. I can on my end then make sure everyone's video pops off, I think. But we think, in this virtual world right now. If everyone can pop on, yeah, there you go. If everyone can pop on real quick, woohoo! And we can all see each other. We're gonna get a big group picture in light of our beautiful situation right now. So let's do that. Okay, close. Everyone, come on. I think we got 29 people. We got 37 on the call, but 29 on video. This is fun.
That's so great.
Waiting for a couple others there, the shy ones. There we go. Okay, so we're looking at the bottom again left, and it says video, so we can turn those on.
Okay.
We'll give it one more second, and then we're gonna do a quick screenshot, and then I'm gonna take a picture from my phone. Timmy's gonna take the screenshot with her. Okay, so there we go, perfect. Okay, so 1, 2, 3, everybody smile. Looking good. Okay, so now we can have a chat, a nice discussion. I mean, we can leave our videos on if you want. Seema, do you see the chat at the bottom of your screen on the right?
I see it on the right side, yes.
Okay, so we'll look at those. Oh, we have a couple saying, sorry, no camera on the desktop. That's okay. Okay, so we have a question from a comment first. Dear Dr. Kanwal, thanks for a great and clear presentation. Our second question is that we have a question. Is it safe to eat lettuce bought from open produce shelves at the market?
Yes, but it's a question of how you're going to wash it. So what I would suggest at this time, but this is actually a common suggestion I have any time of year, from the pharmacy, you can get Lugol's iodine. Lugol's iodine is just literally iodine. So often when, times like winter where it's hard to get organic produce, like organic grapes or whatever, you take your lettuce and you put that in a glass dish, 1 drop of Lugol's iodine solution, and what'll happen is that you let it soak for maybe roughly about like 3 to 5 minutes. That's it. And you're able, and then wash everything really clear, thoroughly again, and you're good to have your lettuce. So with produce, yes, that is important. Is that how do we, when we get home, how do we actually take care of it and wash it? So Lugol's iodine is one of the easiest things that you can actually have just in your cupboard all the time. And it's,
so what's the first part of that? I heard iodine, but what's the first part that you're saying?
Lugol's.
Can you spell it?
Yeah, Lugol.
Oh, Lugol. Okay, thank you. Okay.
Yeah. And that's available at all pharmacies, and that 1 bottle lasts you for years. I've had mine since my son was born, and he's almost 17. So you literally just 1 drop in a glass dish, not stainless steel, not plastic, because it's iodine, so glass dish, and you just let it soak for about 3 to 5 minutes, not even, and then you rinse everything off, and it'll kill everything.
Awesome.
That's what you use in surgeries, right? Is iodine. So there you go.
Okay, we have another one. Going back to those Amazon packages, should we quarantine them when they arrive at home for 24 hours? Wipe them down? What do you recommend?
So that's a hard one because, someone like myself who does get Amazon packages, unfortunately, a little maybe too regularly, what I've been doing lately is literally wiping it all down. You get your gloves and your Lysol wipes or whatever you have at home, alcohol wipes that you have, hopefully wipe down the box before you open it. And then as you open it, I actually also wear gloves. So then I'll open everything and throw everything outside and then wipe everything down.
Perfect. Any more questions for Dr. Kanwal?
While we're waiting for some more questions, though, I also want to make mention too of depending on if you live in an apartment or if you live in a house, what are some of the noises around us? Because some people are very sensitive to noise as well. Like, what do we hear? If we are hearing, the traffic go by or any of that stuff, that is also going to be hard on us. It can be stressful. So what I often like to recommend is either if you're in an area where it is very high traffic, get some of your favorite music on that you enjoy, that you like to listen to, whether that doesn't have to be nature sounds. It could be like YouTube has so many free stuff all the time. And so there's lots of, different sounds out there, different music out there, tap into the music that maybe you don't know. we often will play classical music because my middle child plays piano. So I love putting some type of piano music on while we're having dinner.
Okay, we have two more. I don't know if you can see them, but if not, I can read them to you.
Yeah.
Um, Great presentation, Dr. Conwell. I am over 60 and very fearful. You feel that essential oils will help us stay healthy.
Essential oils are great at a lot of different things. Like, I mean, for our immune support, there's many different companies out there, and there's lots of different essential oils that, you know, have been shown in data to support your immune system. So if that makes you feel better, absolutely. You use them on your hands, and on your feet at night before bed. Often, you know, especially when my kids have been sick through the years, I'll put some essential oils on their feet when they are not feeling well to help support them, and using them at night to help you calm. Like, you know, we all use lavender, I think, often just to help calm our anxiety. But yes, essential oils are very helpful to not only stay healthy, but also your mood. Your mood will be uplifted as well with different types of essential oils.
We have another one. What about sugar and fruit? Can you eat too much if having smoothies, etc.?
Yeah, so the sugar in fruit doesn't mean that you're now immune, that sugar is actually okay. That's why I like to, you know, say we limit the fruit for at least 1 to 2 servings, but nothing really more than that, because fructose is still fructose. It's still sugar. And the way our body's going to handle it is still going to be similar. So, you know, if you're feeling like you're having a sugar craving, or, you know, you're feeling something, so absolutely having a strawberry or having any of those other fruits are okay. But a rule of thumb I like to use is that if you have to peel a fruit, that amount of sugar is a lot higher. But if you don't have to peel a fruit, it'll stabilize your blood sugar better. So something, so for example, bananas, you have to peel. Oranges, you have to peel. The way that they will spike your own blood sugar in your body is a lot higher than, let's say, you know, a strawberry or a blueberry would. That would be a lot less sugar spike in our body. So
Correct.
the rule of thumb, if you have to peel it, it's going to spike your insulin. But don't have to peel it, you're okay. But strawberries are hard to get right now, so frozen.
Just a comment for you. John King is sending this link to his family in Illinois and Alabama, so they need to hear it as well. Great presentation.
Thanks, John.
Another question. So again, thank you for your clear presentation. What should you recommend to receive ERT at home or in the hospital?
That you have to figure out with your nurse what you're feeling comfortable with, because everybody's situation is so unique and so different. I have patients that have switched from home to hospital, hospital to home. Like, I wish I had a clear cut answer on that one. I think, Julia, you might be better to answer that than myself, because it's such an individual
Yeah.
thing. Right?
Yeah, it really is. I mean, we've had lots of patients reach out asking that question. And I mean, I think it's a really tough one, but each, like you said, I mean, depending on where you are, you know,
Yeah.
your hospital may have, in your particular location, you may have no confirmed cases. You may have lots of confirmed cases. So
Yeah.
I think that's another thing to consider as well. But as far as, you know, making that decision, I think it's just a physician to patient, you know, conversation, and then of course with the home care team as well, because really does vary so much.
Yeah, exactly. We're in midst right now as well, like personally, where my mother-in-law is going through chemotherapy, and she lives in a remote place up north in British Columbia. So that was our conversation last night on the phone, is like, does she continue chemo and does she not? So we had this big conversation with our oncologist, whether this is the right thing or not for her. So we'll see what comes of it. So same thing with infusion, have the conversation with your nurse or person that you're working with, and be open and honest, and you guys will figure something out that works best for you and what you feel comfortable with.
Great. Okay, well, I don't think there's any more questions. Seema, do you have any one last, what's your most favorite immune supplement that you take yourself? What's your takeaway for us all?
My personal?
Yeah.
Breathe. Everybody breathe. It's okay. We're going to get through this. Without question. You know, this is a short term, right? Yes, the uncertainty, and we don't know how long this is going to go on for, but let's just enjoy just being. We are just the human doers constantly. We're always so busy. But now all of a sudden, the universe or whatever you believe in has forced you to stay put. So let's take a breath, breathe, let your diaphragm do its job, and this will figure this out, all of us, right? Water. I'm drinking water. It's a cup, but I can't spill it because you'll see. There you go. Drink your water. There you go, Donna. I see that water.
Thank you very much, Dr. Kanwal. That was great.
Problem.
Thank you, everybody, for joining. Take good care of yourselves.
Bye.
Bye. Thank you.